There's a decision waiting for you at age 65, a decision that most people make in about 20 minutes based on a mailer they received in the mail, or a phone call from a salesperson, or a recommendation from a neighbor who does not fully understand it either. And here is what makes this decision unlike almost any other in retirement. You may only get one chance to make it correctly, because depending on which path you choose, and depending on what happens to your health after you choose it, switching to the better option later may be completely impossible. I am talking about the choice between Medicare Advantage and Medicare Supplement insurance, also called Medigap, and it is one of the most consequential and most misunderstood decisions in all of retirement planning. Every year, millions of Americans turn 65 and walk into this decision completely unprepared. They see the Medicare Advantage commercials, the ones featuring celebrities promising $0 premiums, free dental, free vision, free gym memberships, and they think, why would I pay hundreds of dollars a month for a Medigap plan when I can get all this for free? And for some people, in some situations, Medicare Advantage is genuinely the right choice. But for others, particularly those who develop serious health conditions, who need specialized care, or who simply want the predictability and freedom that Medigap provides, making the wrong choice at 65 can mean paying tens of thousands of dollars more in out-of-pocket costs, or being medically underwritten out of Medigap coverage when they finally try to switch, or both. Today, we are going to walk through everything you need to know to make this decision correctly the first time. Hey everyone, welcome back to Life Advice. I'm your name. If you are approaching 65, already on Medicare, or helping a parent navigate this decision, this is one of the most important videos on this channel. Let's get into it. Before we can compare Medicare Advantage and Medigap, you need to understand how original Medicare works, because both options are built on top of it, and the differences only make sense once you understand the foundation. Original Medicare has two main parts. Medicare Part A covers hospital care, inpatient hospital stays, skilled nursing facility care after a qualifying hospital stay, hospice care, and some home health services. For most people who worked and paid Medicare taxes for at least 10 years, Part A has no monthly premium. But it does have cost sharing, a hospital deductible of approximately $1,830 per benefit period in 2026, and coinsurance for longer stays. Medicare Part B covers outpatient care, doctor visits, outpatient procedures, preventive services, medical equipment, and most non-hospital medical services. Part B has a monthly premium, approximately $185 per month in 2026 for most enrollees, though higher income individuals pay more through the IRMAA surcharge we covered in our tax bomb video. Part B also has a deductible of approximately $257 per year and covers 80% of approved costs, leaving you responsible for the remaining 20% with no cap. And that 20% with no cap is the critical vulnerability of Original Medicare. If you have a major health event, a cancer diagnosis, a heart surgery, a prolonged illness, 20% of a $200,000 treatment course is $40,000 out of your pocket from Original Medicare alone. With no ceiling on your exposure, this is the gap that both Medicare Advantage and Medigap are designed to fill. They just fill it in completely different ways, with completely different trade-offs. And understanding those trade-offs is the entire decision. Medicare Part D covers prescription drugs, sold as standalone plans that work alongside Original Medicare and Medigap, or integrated into Medicare Advantage plans. Part D has its own premiums, deductibles, and cost-sharing structures that vary by plan and by the specific drugs you take. Now, when you first become eligible for Medicare at 65, you have what is called your initial enrollment period, a 7-month window centered around your 65th birthday. During this window, you can enroll in Original Medicare and choose either a Medigap plan or a Medicare Advantage plan. And the decisions you make during this window carry more protection and more flexibility than decisions made at any other time, which is why getting it right the first time matters so much. Let's start with Medicare Advantage, also called Medicare Part C, because it is currently the more popular choice, enrolling more than half of all Medicare beneficiaries nationwide. Medicare Advantage is an alternative to Original Medicare. Instead of receiving your Medicare benefits directly from the federal government, you receive them through a private insurance company that has contracted with Medicare to provide at least the same coverage as Original Medicare Parts A and B, and usually more. Medicare Advantage plans often include additional benefits that Original Medicare does not cover: dental care, vision care, hearing aids, gym memberships, transportation to medical appointments, over-the-counter allowances, and more. And many Medicare Advantage plans have monthly premiums as low as $0. In addition to the Part B premium you continue to pay regardless. This is the pitch. And it sounds extraordinary. Comprehensive coverage, extra benefits, zero additional premium. So why would anyone choose anything else? Because here is what the commercials do not tell you. Medicare Advantage plans are managed care plans, typically HMOs or PPOs, And managed care means restrictions. Restrictions that can have enormous financial and medical consequences when you are sick and need care the most. Most Medicare Advantage HMO plans require you to use a specific network of doctors and hospitals. If you want to see a specialist, you typically need a referral from your primary care physician. If you need care at a hospital outside your network, even in an emergency situation when you're traveling, your coverage may be significantly reduced, or in some cases not covered at all outside your service area. Medicare Advantage plans also use prior authorization, a process where the plan must approve certain treatments, procedures, or medications before you receive them. Prior authorization is designed to control costs, but it also means that the insurance company, not your doctor, has the final say on whether a recommended treatment is approved. Denials of prior authorization requests are not rare, and appealing a denial takes time that patients with serious conditions may not have. The cost-sharing structure of Medicare Advantage is also fundamentally different from Medigap. Medicare Advantage plans have co-pays and co-insurance for virtually every service: doctor visits, specialist visits, outpatient procedures, hospital stays, imaging, lab work. These costs are capped by an annual out-of-pocket maximum, typically ranging from $3,500 to $8,300 per year, depending on the plan in 2026. But that cap means a serious health year can cost you $8,000 or more in out-of-pocket expenses, even on a zero-premium plan. And that out-of-pocket maximum resets every January 1st, meaning a multi-year illness faces the cap multiple times. For relatively healthy beneficiaries who stay local, use in-network providers and do not require complex or high-cost care. Medicare Advantage can be excellent value. The zero or low premium, the additional benefits, and the simplicity of a single card for all coverage make it genuinely attractive. But for beneficiaries who develop serious illness, who need access to specialized medical centers, who travel frequently, or who value the ability to see any Medicare-accepting doctor anywhere in the country, the network restrictions, prior authorization requirements, and annual out-of-pocket exposure of Medicare Advantage can create serious problems. Now let's look at Medigap, Medicare Supplement Insurance, and specifically the version of Medigap that the majority of financial planners and Medicare specialists recommend most strongly for most beneficiaries, Plan G, which is currently the most comprehensive plan available to new Medicare enrollees. Medigap works completely differently from Medicare Advantage. With Medigap, you keep original Medicare as your primary insurance, and then you add a Medigap plan purchased from a private insurance company that pays most or all of the cost sharing that original Medicare does not cover. Medigap Plan G, the most popular comprehensive option, covers the Medicare Part A deductible, all Part A coinsurance and hospital costs, up to an additional 365 days after Medicare benefits are exhausted, all Part B coinsurance and copays, skilled nursing facility coinsurance, and foreign travel emergency coverage up to plan limits. The only out-of-pocket cost you face with Plan G is the annual Medicare Part B deductible of approximately $257 per year. That is it. After that $250 annual deductible, everything else is covered. No copays for doctor visits, no coinsurance for outpatient procedures, no surprise bills after a hospital stay, no annual out-of-pocket maximum to worry about hitting because your costs are essentially capped at $257 per year for covered Medicare services. The trade-off is the premium. Medigap Plan G premiums vary by age, gender, location, and insurance company. But for a 65-year-old enrolling at initial eligibility, premiums typically range from approximately $100 to $200 per month. That is now $200 to $2,400 per year in additional premium cost on top of your Part B premium. For a healthy year where you use minimal health care, that premium can feel like wasted money compared to a zero-premium Medicare Advantage plan. But for a serious health year, a cancer diagnosis, a cardiac event, a major surgery, the Medigap premium is the difference between a $250 annual expense and a potential $8,000 or more in Medicare Advantage out-of-pocket costs. The other critical advantage of Medigap is freedom. With Medigap, you can see any doctor, any specialist, any hospital in the country that accepts Medicare, and virtually every doctor and hospital in America accepts Medicare. No network restrictions, no referrals required, no prior authorization for most services, no need to check whether a specialist is in-network before you make an appointment. You simply present your Medicare card and your Medigap card and your cost is covered. For retirees who travel, who split their time between multiple states, who want access to major medical centers or specific specialists, or who simply value the peace of mind of knowing their healthcare costs are predictable and capped, Medigap provides a level of freedom and financial certainty that Medicare Advantage simply cannot match. Now we get to the most critical and most dangerous aspect of this entire decision, the one that creates permanent consequences for people who choose Medicare Advantage first and later try to switch to Medigap. In most states, Medigap insurance is medically underwritten. which means if you try to purchase a Medigap plan outside of your guaranteed issue period, your initial enrollment period when you first turn 65, the insurance company can review your health history and decline to cover you or charge you significantly higher premiums based on pre-existing conditions. Here is the scenario that plays out for thousands of Americans every year. They enroll in Medicare Advantage at 65 because the zero premium is attractive. They are healthy, they like their plan, everything works fine for several years. Then at 68 or 70 or 72, they develop a serious condition: cancer, heart disease, diabetes complications, a neurological issue. Suddenly their Medicare Advantage plan's network restrictions, prior authorization requirements, and annual out-of-pocket maximum matter enormously. They want to switch to Medigap for the unrestricted access and predictable costs, and they discover they cannot, because now they have a pre-existing condition. And in most states, Medigap insurers can deny their application. They are locked into Medicare Advantage, precisely when they need better coverage the most. This is not a hypothetical edge case. This is a well-documented and widely reported problem in the Medicare system. A 2023 Kaiser Family Foundation analysis found that a significant percentage of Medicare Advantage enrollees who tried to switch to Medigap were unable to do so due to medical underwriting. They made a reversible seeming decision at 65 that turned out to be permanent. There are a small number of exceptions, called guaranteed issue rights, where you can switch from Medicare Advantage to Medigap without medical underwriting. These include situations where your Medicare Advantage plan leaves the market, where you move out of your plan's service area, or where you are in your first year of Medicare Advantage enrollment and want to switch back. But outside of these specific circumstances, the medical underwriting barrier is real and significant. A handful of states, currently Connecticut, Maine, Massachusetts, Minnesota, Missouri, New York, Oregon, Vermont, and Washington, have additional Medigap protections that provide broader guaranteed issue rights or community rating that limits medical underwriting. If you live in one of these states, the lock-in risk is meaningfully reduced. If you do not, it is one of the most important factors in your decision. Now let's build a decision framework. Because the right choice between Medicare Advantage and Medigap is genuinely personal, it depends on your health, your finances, your geography, and your priorities. Here is how to think through it. You are in generally good health at 65 and can qualify for Medigap coverage at standard rates during your initial enrollment period. Locking in Medigap coverage while you are healthy gives you guaranteed protection that cannot be taken away, even if your health changes dramatically in subsequent years. Once a Medigap plan is issued, the insurer cannot cancel it or raise your rates based on your health claims. You value unrestricted access to any Medicare provider anywhere in the country. If you travel frequently, spend time in multiple states, want access to major academic medical centers or specialized cancer or cardiac programs, or simply want the ability to see any doctor without network constraints, Medigap is the clear choice. You want maximum cost predictability. With Medigap Plan G, your annual healthcare exposure is essentially limited to the $257 Part B deductible plus your monthly premium. A serious health year costs you the same as a healthy year in terms of additional out-of-pocket expense. That predictability has enormous value for retirement budget planning. You have a family history or personal health factors that suggest higher healthcare utilization over time. The Medigap premium is insurance against high future costs. And if your risk of needing that insurance is above average, the value of the coverage is above average as well. You are on a very tight fixed income, and the Medigap premium, even modest, creates a genuine budget strain. A zero premium Medicare Advantage plan may be more financially manageable in the short term, with the understanding that your out-of-pocket costs in higher utilization years will be greater. You live in an area with a strong Medicare Advantage plan that includes excellent networks, generous supplemental benefits, and a low out-of-pocket maximum. And you have limited need to access out-of-network care or specialized medical centers. You live in one of the states with strong Medigap guaranteed issue protections that allow you to switch more freely if your health situation changes. In those states, the lock-in risk is reduced, and the flexibility to try Medicare Advantage first becomes more viable. You are 65 and in excellent health with no significant family history of serious illness, and the additional benefits, dental vision, gym membership, have genuine value in your daily life, with the understanding that if your health changes significantly, switching to Medigap may not be an option. Enroll in Medicare Part B on time. Delaying. Part B enrollment without qualifying coverage creates permanent premium penalties and coverage gaps. Enroll in a Part D prescription drug plan at 65, even if you take no medications. Because delaying Part D enrollment also creates permanent premium penalties. And review your Medicare coverage annually during the annual enrollment period from October 15th to December 7th to ensure your plan still meets your needs as your health and circumstances evolve. Let me bring this all together with the clearest possible bottom line. The Medicare Advantage versus Medigap decision is not about which option is better in general. It is about which option is better for your specific health situation, your financial situation, your geography, and your risk tolerance, made at the specific moment of your initial Medicare eligibility when your options are widest. For most people with reasonably good health at 65, the financial planning community's consensus recommendation is to consider Medigap Plan G during the initial enrollment period, while you can qualify without medical underwriting. The guaranteed issue window at 65 is the one moment in your Medicare life when your health history cannot be used against you. Using that window to lock in comprehensive, unrestricted coverage, even at a higher premium, provides a protection that no amount of money can buy later if your health declines and Medigap becomes medically unavailable. The zero-premium Medicare Advantage plans look extraordinary on a commercial. They are designed to. But the costs that do not appear in the commercial, the network restrictions, the prior authorization requirements, the annual out-of-pocket maximums, and most critically, the potential inability to switch to Medigap when you need it most, are the costs that define the real value of the decision. This is not an argument that Medicare Advantage is always wrong. For the right person in the right situation, it can be excellent. But it is an argument that the decision deserves far more careful thought than most people give it, and that the lock-in risk of choosing Medicare Advantage at 65 and later developing a serious condition is real, documented, and potentially permanent. Here is your action step this week. If you are within 5 years of 65, go to Medicare Gov and create a free account. Look up your Medicare eligibility date. Mark your initial enrollment period on your calendar. And begin researching Medigap Plan G premiums in your zip code from multiple insurers, because premiums for identical coverage vary significantly between companies, and comparison shopping is genuinely worthwhile. Drop a comment below and tell me, are you on Medicare Advantage or Medigap? Or are you approaching 65 and trying to decide? Let's talk through it. I read every comment. Please share this video with anyone you know approaching 65. It could be the most important healthcare decision video they ever watch. And subscribe to Life Advice for a new video every single week. I will see you in the next one. Take care.